What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ToneAndTighten.com. Do you have pain in the front of your hip? Well, the solution to treating it might be a little different than what you're thinking or maybe even what you're currently doing. Today we're talking all about the hip flexors, what they are, why they might be hurting, and give you a few solutions on how you can help yours to feel better. Let's get into it right now. All right, you guys, hey, thank you so much for joining me today here on Tone and Tighten. I'm excited to be able to share a little bit of what I know about this common problem with you guys. I hope that it helps some of you out. If it does, be sure to hit that thumbs up button down below, and thanks so much for doing that in advance. Okay, so let's get right into it. So hip flexors, those are the muscles right here on the front of the hip. It's an area that's prone to injury. It's an area that's prone to discomfort just because of what we do throughout our day. We spend a lot of time sitting. Maybe you sleep kind of with your hips up in this flexed position. They're prone to becoming short, but that's not always the case, and that's not always the problem. I think the majority of us think, oh, I've got pain in the front of my hip. It must be due to my tight hip flexors. You know, that's the case a lot of times, but in my professional experience, that's not the case all of the time. I'm going to show you what I mean here in just one second. Before I jump into it, though, you guys know me. I've got to give you the anatomy lesson. So here's my spine model, and here's kind of the hips right down in here. This is the socket, right where that ball and socket joint would sit, right up in there. Now, you've got 5 muscles that flex your hip. There's only 2 muscles that take the knee up and above the level of the hip when we're going through active muscle contractions. Now, because of the origin and the insertion of that muscle, because part of that muscle actually originates on our lower back, a lot of times if it gets tight and if it's pulling on that lower back, hip pain or that anterior hip pain can also manifest itself as lower back pain. You'll see that if I have tightness in my hip flexor, if it connects from my femur to my lower vertebrae, and if that's pulling on each other, it's going to rock me forward, it's going to cause some back pain, it's going to cause some hip pain, and I think that that's why the majority of us think, oh, I've got tight hip flexors, and that's why my back hurts, and that's why my hip hurts. Again, true in a lot of the cases, not in all of them. Here's the thing that not a lot of people realize. You can have weak hip flexors, which can also manifest itself as that anterior hip pain. Now, the worst thing that we could possibly do for a weak muscle is actually stretch it out. Meaning, if it's weak, a lot of times that means it's loose. A lot of times that means it's already in kind of a lengthened position. Now, if we just do stretching on top of that, we're actually causing a lot more harm than good. If it's a weak muscle, we need to strengthen it. Now, on the flip side of that, if it's a tight muscle, we absolutely don't want to strengthen it. Meaning, if it's already in a shortened position, we don't want to run it through strengthening exercises that are going to make it a lot tighter. The prescribed treatment for that would be to stretch that area out. And so hopefully you guys understand that it's crucial that we differentiate between those two. Do I have a tight hip flexor or do I have a weak hip flexor? Because I'm going to treat those differently. And that's what I want to show you right now. So let's get into it. I want to show you how to figure out if your hip flexor is tight or if your hip flexor is weak, and then show you about 5 of my favorite exercises to treat each one of those conditions. All right, so let's show you how to check and see whether your hip flexors are in fact tight or not. What you're going to do is sit on the edge of, I usually tell people like a table or a counter or something firm. I know it's not the most comfortable, but if you do it on a bed, a lot of times your bed is so soft that it's hard to see exactly the results of the test because you kind of sink down into the bed. What you'll do is you'll sit on the edge, you're going to rock backwards, you're going to hug both knees into your chest, flatten your back out. Right now my back is nice and flat on that table. I'm going to hold one knee right here into my chest. I'm going to extend the other leg out and then just kind of let it fall down. Just let gravity take over, nice and loose, nice and relaxed. What you should see is that leg, and I'll be the first to admit, I've got some tight hip flexors going on. That leg should be almost all the way down to the table. You know, 10 degrees or less would be considered normal. I would personally, in myself, like to see this all the way down. I do have a little bit of hip flexor tightness going on here. It's important that you check both sides, and so we're going to check for symmetry. One might be very tight, the other might not. One might be, so see, look at that. I think I've even got a little more tightness in that right hip than the left hip. And so, again, if your leg doesn't come in contact with that table that you're on, that can be an indication that you do, in fact, have tight hip flexors. The recommended treatment would be some of the stretches that I'm going to show you momentarily. Let's show you how to check for strength. So if you were coming in to see me in my physical therapy clinic, I would perform what we call a manual muscle test. I would have you raise your leg straight up, I'd push down on it, and I'd be able to get a feel for how strong your hip flexors are. The easiest way that you can do this at home, not necessarily in a physical therapy clinic, is going to be with a chair. So again, you've got 5 hip flexors. It's the 2 that sit basically above the level of the hip that I'm the most concerned about. So to check those out, we kind of eliminate the other 3 from the equation. You do that by bringing your leg into this position. You'll see that all of a sudden now I'm starting with my knee at about the level of my hip. What I want to do now, so my left foot's up on a chair, I'm just going to lift my left foot up off of the chair as high as I can take it, and then set it right back down. I'm going to lift, hold 1, 2, and then back down. Lift and hold 1, 2, and I'm going to perform, about 10 repetitions like this. Now, what you'll see is if your hip flexors are weak, that might be pretty tough to get through those 10 repetitions with good form. That would be an indication of hip flexor weakness. And of course, I want you to check the other side as well. Maybe one side you can get through 10 okay, maybe the other side you only get through like 8 or 9 and you think, holy cow, there's a noticeable difference between those two. Any type of asymmetrical weakness would be an indication that, okay, I don't need you to stretch your hip flexors, I need you to strengthen those hip flexors. And that's what's going to help you out of that pain. And so now that you know the difference between the two, let's stretch if it's tight, let's strengthen if it's weak, and let's show you how to do that right now. There are 3 hip flexor stretches that I recommend to my patients on a regular basis. I want to show them to you guys in order of least intense, kind of easiest to perform, to most intense, kind of most difficult to perform. So the first one I'm going to grab, this is called a stretch out strap. This is probably one of my favorite kind of therapy tools, basically just a piece of webbing with a bunch of loops in it. I've got a link in the description down below if you guys are interested in grabbing one of these. But super versatile, you guys. There's just a lot you can do with these. My first stretch, I'm going to use this. Obviously, if you don't have one of these at home, you can use a belt, you can use a towel, you can use a sheet or a rope, just something that's long enough that you can kind of loop it over your foot. And so what I'm going to do is I'm just going to put that over my right foot down here. Maybe. There we go. So it's just like that. I'm going to lay down on my stomach. Okay, and so that's the setup right there. So I'm in this kind of neutral hip position, meaning there's no flexion in my hip, but there's not any extension either. Now what we can do is actually pull through the hip flexors as I pull on this strap and pull them up kind of into this position right here. Now for a lot of you, that's not going to be too much of a stretch. For some of you, if your hip flexors are really tight, you're actually going to feel a pretty good stretch as you do that. You're going to feel it a lot through your quad, but one of your quad muscles crosses your hip joint. It actually serves as an accessory hip flexor muscle. And so this is just a good way that we can kind of stretch that out. You'd hold this for about 20 seconds, you'd back off of it, and then you'd repeat that 3 times. I wish I had a pillow. If you need something a little more than that, what I would do is put a pillow under my knee. And so now I'm out of the neutral hip position. I'm into this hip extended position, which is going to stretch the hip flexors out. Again, if there was a pillow under my knee, and now what I'm going to do is pull this way. And you guys, I feel that a lot more in the front of my hip. I feel that a lot more in my hip flexors. Again, we've decided mine are a little bit tight. And so that's one way that you can enhance that stretch. And so that's the first stretch that I like. Again, 3 times, 20-second holds, and then you do that a couple times throughout your day. The second stretch that I like is actually the test that I showed you guys for whether or not you have tight hip flexors. So again, right here, oh, I'm going to scoot down just a little bit. Right here, rock backwards, hug a knee, and then just let one drop. And again, you can just kind of sit right here and just relax and just let gravity stretch that hip flexor out. And so again, I'm holding my left leg up into my chest. I'm letting that right leg just hang out. I'd hold that for about 20 to 30 seconds and then switch it up. So now that right leg is up into my chest, left leg is hanging out. Hold that one for about 20 to 30 seconds. If you have someone at home, you can get into this position and then have that person just push down gently on your knee. All of a sudden, that's really going to facilitate even more of a stretch through that anterior hip joint. Lastly, I'm going to show you a tall kneeling hip flexor stretch. Now, this is probably my go-to, but unfortunately this is also the one that I see everybody doing wrong. So let me walk you through it real quick. To stretch out my left hip flexor, I'm going to kneel down on my left knee. My right leg comes out in front of me, kind of down in this lunge position. And then I'm going to push my hips forward into this spot right here. Now, that's the incorrect way to do it because you guys can see what I'm doing. So again, remember the anatomy lesson at the beginning. Those hip flexors connect to my lower back. I want to create separation between my lower back and the front of my hip. If all I do is lean forward, you'll see how I'm like arching my back pretty good. It's just pulling more into what we'd call a lumbar lordosis or a lumbar lordotic curve. I'm not really stretching that hip flexor as much as I could. What you need to do is get into this tall kneel position. Now let's set the hips, let's set the pelvis in the right spot. So I'm actually going to contract my glutes. If I contract my glutes, you'll see that all of a sudden I've eliminated that anterior pelvic tilt. And honestly, even just that little contraction, if I'm just trying to flatten my pelvis out, if you focus on that, so I'm in this tall kneel position, I'm just going to rock my hips backwards. All of a sudden now, you guys, that's roasted. That's a good stretch for that anterior pelvis, for those hip flexors, just to get into that right position. Okay, so now if you need a little bit more, so again, I'm squeezing my butt's tight, my abs are contracted, and now if I lean forward, you'll see that's as far as I can go, you guys. That hip flexor is about to tear if I go any further than that. Again, contrast that from here. You're like, hey, yeah, I don't really feel that much. My back is nice and arched. Flatten the pelvis out, flatten the back out, squeeze the butt, contract the abs, and then it's just a little lean forward. You're going to get a much better, much more efficient stretch there. Same thing, 20 seconds, 3 times, and then perform that a couple times throughout the day. Okay, so now, what if the hip flexors are weak? Let's give you a couple exercises for those. My go-to for weak hip flexors, and I dare say probably the majority of physical therapists out there, this is probably their go-to as well, is going to be what we call a straight leg raise. So you're going to sit with your legs straight out in front of you. The first contraction here is actually to contract your quads. So I want you to fire those quad muscles. I want those nice and tight. So you're going to fire your quad, and then you're going to lift your leg up about, 12 to 18 inches. About a 30 to 45 degree raise is what I'm after. So contract the quad, up, hold 1, 2, and then down nice and slow. So it's just nice and slow up, and it's hold, and then it's nice and slow down. It's going to really work those hip flexors. Now, with my patients, when that becomes easy, when you get to be able to perform, 50 or 60 of those in a row, I like to add what I call an inverted L. And so now what I'm going to do is I'm going to contract that quad. I'm going to go up. I'm going to go out. So that's towards you guys. I'm going to come back to that neutral position, and then I'm going to go down. Basically what I do there is I increase time under tension. You're holding that contraction for longer. We're making it an even stronger contraction for that hip flexor. Contract the quad, up, out, back, and down. And again, your goal is to get through about 3 sets of 20 of those, kind of, the 50 to 60 rep range is what we're after with that one. Okay, one more to show you. So I already showed you guys how I like to check for hip flexor weakness. Ironically enough, it's also the exercise that I like to perform with people. You're going to come to a chair. I want your knee parallel to your hip. And so I don't want it to be too short. You're going to start down here. I don't want it to be so high that we're already unable to get a contraction out of it. So look for something that's about that high. Again, my knee, same level as my hip. I'm going to hold everything nice and tight. I want to contract the abs. I want to contract the glute on my right leg. Everything's nice and tight. Now we're just going to raise that leg up off of the table, or excuse me, off of the chair, off of the bench, whatever it may be, and then right back down. It's a lesson in balance, but you guys, if you've got weak hip flexors, that one's going to roast them. That you're going to get through about 30 sets of this. I tell people shoot for 3 sets of 10, and that becomes real right there. If you get to the point where you can get through those 3 sets of 10, and if you need a little bit more resistance, you can strap an ankle weight around your ankle, or you can put a band over your foot and then anchor it down onto the floor somehow. And so again, about 3 sets of 10 on that one is what we're after. All right, you guys, there you have them, all about your hip flexors, how to check if they're tight, how to check if they're weak, and about 5 exercises that you can do to hopefully overcome these problems. Hey, I hope you guys enjoyed this video. Of course, if you did, I would love if you left me that thumbs up, so thank you so much for those likes in advance. If you have any questions or comments, anything that I can help you out with, please leave those in a comment down below, and I'll get to it just as soon as I can.